It's September 11th, 1942, and somewhere beneath the enemy-controlled waters of the South China Sea, USS Seadragon SS-194 faces a medical crisis that could prove deadlier than any Japanese destroyer. Deep in the submarine's cramped quarters, Seaman First Class Darrel, Rector of Kansas, writhes in agony as acute appendicitis threatens his life. With their submarine cruising in hostile waters and no possibility of reaching an Allied port in time, the crew faces a stark reality. Rector will die unless someone performs emergency surgery. The burden falls to pharmacist's mate First Class Wheeler B. Lipes, a 22-year-old from Virginia who has never performed surgery alone. Like all World War II submarines, Seadragon's 55-man complement carries no doctor, only Lipes, a well-trained corpsman who has assisted Navy physicians during previous operations. Now, 200 feet beneath the surface, he must make an impossible decision. Attempt an appendectomy that could kill his shipmate, or watch helplessly as sepsis claims Rector's life. Fast forward 82 years to today's nuclear submarines, and the fundamental challenge remains unchanged. Modern Virginia-class submarines carry sophisticated medical equipment and satellite communication systems, yet they still deploy with just one medical professional. Independent duty corpsmen serve as the sole medical department representative aboard submarines, responsible for all patient care and medical management for crews that can exceed 130 sailors. During patrols lasting 70 to 90 days, these underwater vessels become isolated medical environments where a single corpsman must handle everything from routine illness to life-threatening emergencies. Unlike surface ships that can helicopter patients to hospitals or divert to the nearest port, submarines conducting classified missions often cannot surface, cannot break radio silence, and cannot compromise their operations even when a crew member's life hangs in the balance. This is the reality of submarine medicine, where advanced technology meets primitive isolation and where a single medical professional must be prepared to perform miracles hundreds of feet beneath the waves with no backup and no margin for error. The path to becoming a submarine's sole medical guardian begins long before any sailor ever sets foot underwater. Independent duty corpsmen attend a comprehensive 19-week training program at Fort Sam Houston, Texas, followed by an additional 58 weeks of submarine-specific instruction, including 6 weeks at the Basic Enlisted Submarine School in Groton, Connecticut. This grueling education transforms hospital corpsmen into what the Navy considers the most versatile medical professionals in its ranks. Hospital Corpsman First Class Matthew Carter, currently serving aboard the Los Angeles-class attack submarine USS Albany, SSN 753, at Naval Station Norfolk, exemplifies this demanding role. As Albany's independent duty corpsman, Carter represents the evolution of submarine medicine from the days when corpsmen like Wheeler Lipes relied solely on basic training and improvisation. I started my career as a behavioral health technician from the Naval School of Health Sciences, Carter explains. I later completed training at the Basic Enlisted Submarine School and subsequent training at the Naval Undersea Medical Institute in topics covering radiation health and clinical and operational medicine. The scope of responsibility is staggering. Submarine Force Independent Duty Corpsmen serve as the medical department representative and perform basic patient care aboard submarines and at isolated duty stations, independent of any medical officer. They must master diagnostic procedures, advanced first aid, basic life support, nursing procedures, minor surgery, basic clinical laboratory procedures, and other routine and emergency health care. Unlike their counterparts on aircraft carriers who work alongside teams of doctors and specialists, submarine IDCS operate in complete medical isolation. The nuclear environment adds another layer of complexity. These corpsmen also serve as radiation health officers aboard submarines, trained in the medical aspects relative to personnel exposed to ionizing radiation, maintaining and compiling radiation exposure, records, and reports. When reactor incidents occur, the IDC must simultaneously treat radiation exposure while managing the crew's medical needs and monitoring for long-term health effects. IDCs fulfill duties in more than 38 occupational specialties, essentially functioning as an entire medical department compressed into a single person. They serve as clinical technicians, administrative personnel, and primary care providers, all while maintaining the submarine's operational readiness. Carter demonstrates this versatility. I support Albany's combat operational readiness through the maintenance of 100% medical and dental readiness, conducting preventive medicine inspections, and monitoring and assessing occupational exposure to ionizing radiation. The recent COVID-19 pandemic showcased how these medical professionals adapt to unprecedented challenges. Carter led his submarines pandemic response efforts, explaining, "During the global pandemic, I have triaged and managed COVID-19 concerns, allowing for sustained operations. I've supervised and conducted 1,500 screenings and provided all-hands training on infection control. All of this occurred while maintaining the submarine's classified mission parameters and operational security. Being an IDC is one of the biggest rewards any hospital corpsman can hope to achieve," reflects Chief Hospital Corpsman Jeremy L. Seaman. "We are entrusted to care for some of the most talented and selfless men and women in our country. Our professionalism and quality of care has a direct impact on the health and well-being of our Navy and Marine Corps team. The medical facilities aboard modern submarines represent a remarkable feat of engineering, cramming an entire emergency department into a space barely larger than a walk-in closet. Virginia-class submarines measuring 377 feet in length and 34 feet in beam must accommodate sophisticated medical equipment within severely constrained spaces while maintaining the vessel's stealth capabilities and structural integrity. The medical bay's compact design reflects decades of lessons learned from submarine medical emergencies. Unlike the improvised operating theater aboard the 1942 USS Seadragon, where Wheeler Lipes used the wardroom table as his surgical platform under massive torpedo-loading lamps, today's submarines feature purpose-built medical compartments with specialized equipment designed for underwater operations. Modern submarine medical bays include digital diagnostic equipment, portable X-ray machines, ultrasound devices, and comprehensive surgical instrument sets. Advanced life support equipment monitors vital signs while sophisticated ventilation systems maintain sterile environments during medical procedures. These submarines also carry submarine escape immersion equipment AMK-11 suits that enable ascent from depths up to 600 feet, though this limitation means that submarines operating at greater depths face complete medical isolation. The integration of satellite communication technology has revolutionized submarine medicine. Maritime telemedicine systems now allow real-time consultation between ship medical personnel and specialists at onshore medical centers. These systems enable independent duty corpsmen to transmit patient data, medical imagery, and even live video feeds to specialists thousands of miles away, effectively bringing entire medical teams into the submarine's cramped medical bay. Advanced telemedicine platforms like Marine Doctor, MMDoc, work as intelligent guides to collect symptoms and assist crew members with no medical background in properly interacting with shore-based physicians. The system standardizes medical data collection and transmission, allowing onshore medical centers to provide more accurate diagnoses and treatment recommendations. However, technology has its limitations underwater. Video calling capabilities require 8 megabits per second internet connections, which remain unlikely on submarines during tactical operations. When communication systems fail or operational security prevents satellite contact, independent duty corpsmen must rely entirely on their training and the medical equipment available within the submarine's hull. The scale of the challenge varies significantly between submarine classes. Ohio-class submarines with crews exceeding 150 personnel during 70 to 90-day patrols require more extensive medical facilities than smaller attack submarines. The larger crews increase the statistical probability of medical emergencies, while extended patrol durations mean longer periods of complete medical isolation. Spanish Navy's Telemedical Assistance Services, TMAS, Center offers 24/7 remote monitoring services to naval vessels, with specialists available at the Central Defense Hospital in Madrid to support military personnel. These services include teleconsultation, teleradiology, telecardiology, and teleultrasound capabilities, demonstrating how modern navies integrate shore-based medical expertise with shipboard capabilities. The medical bay also serves as the submarine's radiation monitoring center. Independent duty corpsmen maintain detailed radiation exposure records and reports while monitoring crew members for potential exposure to ionizing radiation from the submarine's nuclear reactor. This dual responsibility requires specialized equipment for radiation detection and medical countermeasures for potential nuclear incidents. Despite technological advances, the fundamental constraint remains unchanged. When medical emergencies occur hundreds of feet underwater, the submarine's medical bay becomes an isolated island of medical care, completely dependent on the skills and equipment contained within its compact confines. The most dramatic submarine medical emergency in naval history unfolded on September 11, 1942, when pharmacist's mate first class Wheeler B. Lipes faced the most difficult decision of his life aboard USS Seadragon. With their submarine cruising in enemy waters and no possibility of medical evacuation, Lipes had to choose between attempting a dangerous surgery or watching his shipmate die from acute appendicitis. The emergency surgery was performed in the submarine's tiny wardroom using improvised instruments that would horrify modern medical professionals. Lipes gathered his makeshift surgical kit: 12 small hemostats, a packet of scalpel blades with a spare hemostat used as a handle, 5 bent-handled tablespoons serving as retractors, and gauze sponges as surgical pads. The operating theater consisted of the wardroom table, illuminated by massive lamps normally used for loading torpedoes at night. Sterilization procedures reflected the submarine's limited resources. Boiling water sterilized the basic instruments, while rubber gloves and pajamas serving as operating clothing were disinfected with torpedo alcohol. Most remarkably, a gauze-covered tea strainer soaked with ether kept the patient unconscious throughout the procedure. The skipper made detailed observations at 4 to 7 minute intervals as Lipes made his incision at 11:07 hours. The operation proved more challenging than anticipated. Initially, Lipes had difficulty locating Rector's appendix, but eventually slipped his fingers behind the cecum and found it, the distal tip black and gangrenous. The delay could have proven fatal. Gangrene indicated the appendix was on the verge of rupturing, which would have caused deadly peritonitis. Lipes successfully detached the appendix, tied it off, removed it, and preserved it in a jar of torpedo alcohol. He demonstrated remarkable surgical technique under impossible conditions, cauterizing the stump with carbolic acid and sprinkling ground sulfa tablets baked in the ship's oven to kill spores into the peritoneal cavity. The operation concluded at 13:22 hours, with Rector regaining consciousness less than 30 minutes later. The surgery's success exceeded all expectations. Rector's 3-inch incision healed properly, and he returned to duty within days. 6 weeks later, when Seadragon returned to port, the medical officer of the submarine squadron pronounced Rector fit for duty, validating Lipes' extraordinary surgical achievement. This underwater appendectomy was not unique in its necessity, but in its success. During World War II, 3 unassisted emergency appendectomies were performed by hospital corpsmen serving on submarines beyond hope of medical evacuation. The statistical reality of extended submarine operations made such emergencies inevitable. The official Navy report praised Lipes' pioneering fortitude and resourcefulness while acknowledging that it is by no means desirable to encourage major surgical procedures on naval personnel by other than qualified surgeons. The report noted that deliberation and cautious restraint preceded the operation. The operation was performed under difficult circumstances and with pioneering fortitude and resourcefulness, and the result was entirely satisfactory. Despite the surgery's success and the commanding officer's support, the U.S. Navy removed Lipes from active submarine service, though he later participated in war bond drives and factory visits due to publicity from the incident. The case established precedents for submarine medical procedures that influence training protocols today. While technology has advanced dramatically since Wheeler Lipes performed surgery with bent tablespoons, modern submarine medical practice faces unique 21st century challenges that would have been unimaginable during World War II. Extended deployment schedules, nuclear reactor monitoring, and evolving health threats create complex medical scenarios that test even the most extensively trained independent duty corpsmen. Modern submarine patrols lasting 70 to 90 days represent significantly longer periods of medical isolation than their World War II predecessors. These extended deployments increase the statistical probability of serious medical emergencies while simultaneously limiting options for medical evacuation. Ohio-class submarines operate with dual crews, blue and gold, each serving these extended patrols, meaning that medical personnel must maintain readiness for months-long deployments with no opportunity for consultation or relief. Nuclear propulsion introduces medical complexities unknown to diesel-electric submarines. Independent duty corpsmen must serve dual roles as medical providers and radiation health officers, maintaining detailed radiation exposure records and monitoring crew members for potential exposure to ionizing radiation. This responsibility requires specialized training in radiation medicine, dosimetry, and nuclear incident response protocols that extend far beyond traditional medical practice. The COVID-19 pandemic demonstrated how global health crises impact submarine operations in unprecedented ways. Hospital Corpsman First Class Matthew Carter aboard USS Albany managed pandemic response while maintaining operational security, conducting 1,500 individual screenings and providing comprehensive infection control training to the entire crew. The challenge of preventing disease transmission in the submarine's enclosed environment while continuing classified missions required innovative medical protocols developed in real time. Modern maritime telemedicine systems provide unprecedented access to shore-based medical expertise, with the Spanish Navy's TMAS Center offering 24/7 remote consultation services, including teleradiology, telecardiology, teleophthalmology, and tele-ultrasound capabilities. However, operational security requirements often prevent submarines from utilizing these communication systems during sensitive missions, effectively recreating the medical isolation experienced by their World War II predecessors. Advanced telemedicine platforms face significant technical limitations underwater, with video calling capabilities requiring 8 megabits per second internet connections that remain impractical during most submarine operations. When satellite communications fail or operational requirements mandate radio silence, independent duty corpsmen must rely entirely on their training and onboard medical equipment, just as LIPS did in 1942. Mental health challenges have become increasingly recognized as critical submarine medical issues. Extended underwater deployments, confined living conditions, and operational stress create psychological pressures that require specialized intervention. Independent duty corpsmen receive training in behavioral health techniques and serve as the primary mental health resource for their crews, adding another layer of responsibility to their already extensive duties. Modern submarine escape capabilities remain limited to 600-foot maximum depths using submarine escape immersion equipment, meaning that submarines operating in deeper waters face the same absolute medical isolation that confronted World War II boats. Despite decades of technological advancement, the fundamental challenge persists. When submarines operate beyond rescue depth during classified missions, the independent duty corpsman remains the sole barrier between crew members and death. Contemporary IDCS like Carter must balance multiple responsibilities simultaneously. I have performed numerous medical and radiation health inspections while hosting medical officers and IDC students during their clinical rotations, providing real-world training as they prepare for fleet assignment. This mentoring role ensures continuity of submarine medical expertise while maintaining operational readiness. More than 8 decades have passed since Wheeler Lipes first demonstrated that life-saving surgery could be performed in the cramped confines of a submarine hundreds of feet underwater. Today's independent duty corpsmen carry forward this legacy of medical excellence under impossible conditions, armed with sophisticated equipment and advanced training that would astound their World War II predecessors. Yet the fundamental challenge remains unchanged. In the ocean's depths, a single medical professional stands between life and death for more than 130 crew members. Modern IDCs must master clinical skills across 38 occupational specialties while serving as their submarine's sole medical authority. They perform emergency surgery guided by satellite-linked specialists thousands of miles away, monitor radiation exposure from nuclear reactors, and manage mental health crises during months-long deployments, all within spaces barely larger than hospital supply closets. The scope of their responsibility is staggering. During global health emergencies like COVID-19, submarine corpsmen become one-person pandemic response teams, conducting thousands of health screenings while maintaining operational security and mission readiness. On extended patrols lasting up to 90 days, these medical professionals must be prepared for every conceivable emergency, knowing that evacuation to surface medical facilities often remains impossible due to operational requirements or depth limitations. While maritime telemedicine has revolutionized submarine medical care by connecting underwater crews with shore-based specialists, the technology's limitations remind us that submarine medicine remains one of the most challenging medical practices on Earth. When communication systems fail, when operational security prevents radio contact, or when submarines operate beyond rescue depth, independent duty corpsmen face the same isolation that confronted Lipes in 1942. The courage required to accept this responsibility deserves profound respect. We are entrusted to care for some of the most talented and selfless men and women in our country, explains Chief Hospital Corpsman Jeremy Simon. Our professionalism and quality of care has a direct impact on the health and well-being of our Navy and Marine Corps team. In an age of telemedicine, robotic surgery, and instant global communication, submarine medicine remains fundamentally unchanged. One highly trained individual, isolated beneath hundreds of feet of water, wielding medical expertise that can mean the difference between life and death. When emergencies strike in the abyss, there is no 911, no ambulance, no emergency room. Only the steady hands and exceptional training of the submarine's medical guardian,